My name is Sarah Dugan. I'm a mental health pharmacist. I'm faculty here at NeoMed. Welcome to our last Thursday of September. So our last of the psychotropic medication presentations for this ECHO session. Kara, I see you. Can you just nod if you can see my slides? Excellent. I had a episode not long ago where I could see them. They look like they were shared, but for some reason they didn't project out. So I just want to double check. So as the last week of our psychotropic medication topics, we're here to close the circle on some of the other information. So our focus for today is going to be on monitoring mental health medications. Objective-wise, there's two things I hope to accomplish. One is to define the parameters that are monitored. There's two buckets of considerations for monitoring: efficacy and tolerability or safety. So there's your definitions already. So those are going to be the ones that we focus on. And then we're going to look at some common monitoring considerations. We're going to go back to the three classes that we used last week for the adverse effects and contraindications, because they tend to be used relatively commonly with the kids that you're caring for. So our antidepressants, antipsychotics, and mood stabilizers. Full disclosure, this is a brief presentation to ensure that we have time for the case. So this is not complete. So if you see something that maybe is being done with one of the kids that you care for, that may absolutely be the case. I tried to include what's most commonly used in monitoring for these medications. With our medication classes, I did take a couple liberties in changing from the list that we used last week. One change I would like you to note is in our antidepressants. So we have 4 different types of antidepressants that are listed there. I swapped out the sertraline for trazodone, as that has popped up a few times in individual cases that we've covered, and that's a little bit unique compared to some of these other medicines. The other change that I made was I swapped out on the mood stabilizer side lithium. So I included that in the place of oxcarbazepine because that one has some unique monitoring considerations as well. So with our monitoring, it is really important that we're watching the efficacy, that the medications are doing what we want them to do, and the tolerability or safety. What are some of those factors we need to make sure to keep the individual safe and able to be taking that medication appropriately? There are no medications, even placebo, so medications that are either just sugar or filler pills that don't contain an active ingredient, they have adverse effects. So we can't get away from them, but how can we monitor them to make sure it's not causing undue burden or potential harm? So let's get started. With our monitoring, some of the feedback, which I appreciated from prior sessions, was that it's helpful to look at these in cases in the context of a case. So we're still using our dogs from my neighborhood as our cases. So these are the same cases we used last week to look at a different consideration. So Molly, being a 14-year-old female with severe major depressive disorder, she's been in therapy, but symptoms have progressed, so she was started on an antidepressant. So recognizing that we have reached the point where, yes, the medication is being initiated, our focus now is what are we watching once that prescription changes hands? So for our 2 buckets, I think that the teams that we've been very fortunate, the teams that we've had present cases have a wealth of information about the patients that they're caring for. They know so much information, so being able to get to really those discrete pieces of information that help us the most can be really important and help with everyone's time in terms of efficiency. So for Molly, if she's being treated for depressive symptoms, it's important that everybody is on the same page for what are those depressive symptoms that are the biggest problems for her right now. Is it her sleep is all out of whack? She's not sleeping, she's sleeping all the time. Is her appetite all over the place? Is it that she doesn't have any interest or motivation? Are there suicidal thoughts? What are those couple things that are most problematic for her right now that help push it over the threshold where she needed treatment, she needed a medication. Those are the ones we want to track. We want to make sure we're collecting the information on those to say, absolutely, this medicine is helping with her depression. And we know because she went from sleeping 16 hours a day to sleeping 12 hours a day, and she's able to get up and engage in some other activities. So really making sure that we're all clear, the family's clear, Molly herself is clear, everyone else on the team knows exactly what direction we're moving in. On the tolerability and adverse effects side, I did break these down by medication. One thing you'll see all the way across the top is suicidal ideation. So our antidepressant medications carry a class risk of potentially causing some suicidal thoughts, especially in adolescents and young adults. So watching, especially early on in that first month or so, there's probably not going to be efficacy. She's not going to see a significant improvement in her depression symptoms. And we want to make sure those suicidal thoughts, if she has any, don't pop up and become a problem for her. So that would be something we're watching early on in treatment. Or if we increase the dose, we'll want to revisit that. Has she started having any thoughts of hurting herself at that point? So that'll be really important, for, obviously, from a safety perspective. Some of the other considerations, so bupropion, this is Wellbutrin, it tends to be a little bit more activating, and we can see in some patients, we can see an increase in their anxiety when they first start this medication. So maybe we thought this was a depression, but as we see some of these other side effects that have really popped up and become more prominent, we may need to look at changing the medication. Or maybe the anxiety didn't look like it was an issue and now it's been much more exaggerated. It can cause some weight loss. Sometimes that could be used to an advantage, but if an individual has an eating disorder, this medication in particular can lower the seizure threshold. It makes it more likely that a patient can have a seizure. So we'd want to make sure that if they have an eating disorder, this would not be a good option for them. And if they're on the lower end of the weight range, we don't want to push them to being underweight. So we want to make sure that we're tracking their weight, that maybe at home they're tracking their weight. It can have an impact on blood pressure and raise blood pressure a little bit. Not usually so much where it's a big problem medically for the patient, but if it does start to creep up, or if we're using it with other medicines like our stimulants, Ritalin, Adderall, those can also increase blood pressure. We don't want to start causing medical problems from those. So it wouldn't be, so this would be one of the medications where we would want to be checking what their blood pressure looks like when they come into the office. The liver function on here, the liver metabolizes the medications. That's why there's the little asterisk. So not that the bupropion is going to cause liver damage, but we really need the liver to be working well, especially if there's other medicines on board to ensure it can process this medication. That holds true for the fluoxetine, the Prozac also. Prozac, the fluoxetine, belongs to our serotonin reuptake inhibitor. So one of the real common classes, so your Zoloft, your Paxil, your Lexapro. So in addition to the liver function we talked about and suicidality, these can cause changes in sleep. So if we all of a sudden see a big change in sleep where she had been sleeping all the time and now she can't get to sleep at all, or sleep wasn't an issue and now she can't sleep at all, those are things that would be important for us to know. That might actually make her depression worse if we're really worsening what her sleep schedule looks like. Most patients are able to adjust to that. They get tolerant to those effects. If it makes them sleepy, you take it at bedtime. If it keeps you up, we're going to take it in the morning. But this could also be an indicator that maybe Molly has bipolar disorder. So by not sleeping, we start to see different symptoms. So this would be one of the big things we want to make sure that we're tracking while they're on these type of medicines. These medicines also can cause some restlessness. So asking the patient if they feel restless or that they just really can't be comfortable or sit still. And in some cases, it can cause some heart problems. So if the patient has any type of a history or is on other medicines that can impact the heart, we might want to hook them up and get one of those EKG readings. Trazodone, as you can see there, again, we might have some blood pressure. This one can cause liver damage at higher doses. So you may see blood draws being asked for, not commonly, not all the time, not every month, but after they've been on it for a couple months, just to make sure we haven't damaged the liver at all. And then with the venlafaxine, we can also see some changes in their weight. So they can have some weight loss. So we do want to watch their height and weight and make sure, especially some of the kids, that they're progressing at the rate that they want to. So even with this class of medicines, most of the things we're monitoring are going to be things that we ask the patient or family member about. So it's important that they know what we want to know. Are you having trouble with these particular things? There might be some measurements, weight or blood pressure, and in a couple cases, we might want to take some blood. For some of our other classes, you'll see it looks a little different. So Grady's a 16-year-old male with autism spectrum disorder, increasingly aggressive episodes, and is being started on an antipsychotic medication. His little nose got cut off, sorry about that. So again, with efficacy, what does aggression actually mean? Is it property damage? Is it interpersonal violence? Is Grady attacking, going after mom or siblings or dad or people at school or staff wherever he goes if he's in a partial hospital program or a residential facility? Is it verbal outbursts that are happening? Is he doing self-injurious behaviors? What are those aggression symptoms so we can track and make sure, especially with this class, that the medicine we started is actually showing improvement? Because there's a lot of things we got to watch with our antipsychotic medications. So with these medicines, I'm going to give you a chance to look at things across the board. I'm going to lump them into 3 different categories. So one is going to be metabolic effects. So we recognize, especially with our newer antipsychotics, the Abilify, aripiprazole, the Seroquel or quetiapine, and the Risperdal, the risperidone, that they cause a lot of metabolic side effects, medical things. We can see increases in weight. We can see increases in blood sugar, which can put the individual at risk for developing diabetes. We can see increases in cholesterol, which may then require treatment because we don't want Grady, who's 16, to develop heart disease. And then because the weight goes up or some of those other factors, we can also see changes in blood pressure. So we'll have to watch that as well. With the weight, interestingly, with our antipsychotics, the weight tends to, I'm referring to my belly and you can't see my, my hands, the weight distribution tends to come in right around the belly. And that's one of the worst places for individuals to put on weight because that can increase your risk for other medical complications, especially some heart problems later on. So watching all of these factors, if we start to see them, we don't want Grady. We control his aggression, great, but now he has high blood pressure and high cholesterol and diabetes, and he's on 7 other medications, and he has lifelong diseases that might have significant complications. So we really need to track these. So partnership with the pediatrician or their primary care provider would be really important for these. Movement disorders. All of these medications can cause different movement disorders, which we talked about last time. Some of them, so the haloperidol, our one representative older agent, can cause more movement disorders than some of the others, but they all can do it. Some of them, the ones that may happen right away, that dystonic reaction that's really uncomfortable, those sustained muscle contractions, that may mean I'm not taking that medicine. And depending on where it is, that may be a medical emergency. So when we first start the medicine, or if we increase the dose, if they notice anything, they need to make sure that they're letting their providers or calling their pharmacy. We also have to track for these because there are some movements that might be irreversible. Once a patient gets them, they may not go away. Now, not as common for the younger patients. It tends to be with high doses used for a long period of time, but there are rare exceptions to that. So we want to make sure we minimize their exposure as much as possible. The last thing I want to mention here is, especially in our adolescent patients, these antipsychotic medications, yes, they can work for some of those aggressive behaviors, but that's not all they do. And part of the chemicals that they can interfere with are some of the reproductive chemicals and hormones, so testosterone and estrogen. So it may actually interfere with both the puberty development of some of these individuals, as well as their sexual health and their sexual development. Grady was a male, so in this case, some of our more potent dopamine agents, so our older agents, haloperidol and then risperidol, if we're using those higher doses, can actually cause breast development in males. So it changes some of the chemicals and they can develop breast tissue. That can be incredibly upsetting for some of the male patients, as well as for some of their family. In females, they can also have breast development, but they also can start producing milk, even if the patient hasn't been pregnant. And it could potentially cause them to not have their menstrual cycle. So a lot of these other things could be going on, which might impair some of their development in other areas of their life, but also potentially impact their quality of life if it starts causing some sexual dysfunction. So lots of different areas we need to work with here. So that's why it's so vitally important that we're sure these are effective, so that the side effects that come along with them are justified. Our last class of medications, I'm kind of proud of these pictures. It took me a while to get them all on there. So George is a 17-year-old male that was diagnosed with bipolar disorder and started on a mood stabilizer. So recognizing what are those symptoms? So what is the mood episode that we're targeting? What are those specific factors that are most problematic that we're going to be able to track and say, yes, this is working for George? Because these also have quite a few adverse effects. I'm going to start with the Lamictal or the lamotrigine because that one actually has fewer than some of the other agents. Similar to our antidepressants, most of our seizure medicines also carry that risk, that suicidal thought warning. So potentially when they start it, they can have those increased suicidal thoughts. Lamotrigine, when we start the medicine, can cause a rash. The rash could progress and then attack some of their mucous membranes. So any openings that you have in your body. And they could potentially, I have a little warning that came up there, they could potentially progress and shut down some of your organs. It could be a fatal condition. So it's really important we're watching for the rash when they first start the Lamictal or the lamotrigine. For our other medicines, we are going to be looking at both things to have the family monitor as well as blood work, unfortunately. So if you have somebody who is not going to cooperate as far as getting blood draws done, then that might be a really big stumbling block for these medicines. We can track the level of these medicines, the carbamazepine, which is Tegretol, the Divalproex, which is your Depakote, and the lithium. We can track those levels and make sure it's where we need it to be. We also have to watch for different things. So electrolytes, sodium levels. The sodium levels can be impacted by carbamazepine and lithium. That can lead to a lot of other medical complications. We can impact some of their blood counts. So carbamazepine can reduce their white blood cells. That may mean that they can't fight off an infection, and especially right now, that could be incredibly problematic. The white cells aren't exactly for the viruses, but any other type of infection, that bacterial infection they may encounter. The Depakote could decrease their platelets, so they're not able to clot, so they may bruise or bleed really easily. The Depakote can also cause teratogenicity, so birth defects. So I know that George was a male, but if he was a female, that would be something we would need to monitor. So with these, there's a lot that we have to watch to make sure that we can use these safely, because we don't want to result in either decreasing the quality of life of the patient or the family, or resulting in other medical complications. So with those 3 classes of medicines, making sure we're all on the same page for what are the symptoms to make sure that this is being beneficial, and then what do we need to watch for on the side effects side of things. For things like antidepressants, we're not using as many blood draws, but we definitely are using the blood draws for things like the antipsychotic medications and the mood stabilizers. So making sure that our mental health providers, our primary care providers, and the labs are really all on the same page can help streamline things for the whole treatment team. With that, I'm going to stop share and turn it over.